Let's do some Q&A. Do I need a prescription for my MyHixel control? No, you do not. You can go to menmd.com and buy a MyHixel. They are the exclusive distributor of this device, and they are very, very good at getting it to you promptly and effectively. You don't need a prescription at all for this. It's very, very something you can do by yourself. Before you even come to see me, you may solve the problem by yourself. Has the efficiency of MyHixel been tested? Yes, as I talked about, there was a randomized control study that was performed in 2021, published in the journal of PLOS1, and it showed a definite increase. They took two groups. Randomized control study means you have one group that did get the treatment and one group that did not. And the group that got the treatment had a distinct improvement over the course of 8 weeks of treatment in their intravaginal ejaculatory latency time. No question. Distinct improvement, scientifically, statistically proven, versus the guys who did not, who didn't get any better, right? So definitely a very, very useful tool that is scientifically proven to be useful for you. Will you enjoy the MyHixel treatment plan? I tried it out. It's hard not to enjoy a very well-designed sex toy. It's also hard not to gauging your own limitations, right? And trying to push the envelope and seeing how far you can get. The app is very, very useful. The app is essentially designed as a series of traveled, in this series of planets. You go from one to the next, the next, the next, that help you gauge your improvement, right? And that improvement is the app tracks that very, very clearly. And I'm a guy who likes making improvement in things, right? I'm a guy who really likes to see progress and see things change. It's part of the reason why I became a doctor, so I can make people better. And you can do that yourself with this app. So not only is the device itself fun, how could it not be fun? But also the app itself, very fun in that you see incremental gains in your progress, which makes you feel better about yourself. Totally, very, very fun. Is there any risk involved in this treatment? Not that I can identify. I didn't see any risks at all. The study had no risk they talked about. It's a pretty safe device. I mean, what could go wrong? I don't think there's anything that's wrong with this as far as or dangerous or anything like that. There's no risks I can think of. It seems like a very safe, useful tool in this circumstance. What should I do if I feel pain while following this methodology? Very important. What I would suggest is go back and read this very, very detailed instruction pamphlet that it came with. Very, very detailed. It's got a lot of important pages, lots of print in here. I read it a couple times before I tried it out, just so I made sure I knew what I was talking about. If you persistently have pain in that circumstance and using this device, even after reviewing the app, looking at this instructional booklet, looking online, if you're still having problems and you're still having pain, I would definitely find a sexual medicine specialist and talk to them about what could be going on. But again, not painful. When I tried it, worked out perfectly well. How do I clean my MyHixel device? That's a very important question. This is a device using for your own sexual pleasure. There may be ejaculate in it. How do you clean it? Well, it comes with this very fancy spray that you use to clean out the inside, but really, essentially, it's disassemblable, right? Which is not really a word. I made that word up, but you can disassemble this product, right? So you take out the central core, and then you have the sex toy component, and you can invert it, right? And clean the whole thing out in the sink with soap and water. Use the spray to keep it fresh, for example. Let it air dry, and then put the sleeve back inside out where it came from in the normal fashion, and put it back in the device. Wash it with plenty of water. Really not a great idea to use soap. I take that back. Soap is not great. Just you don't want to damage the plastic this is made out of. And of course, you want to put the vibrating portion of the device back in the sleeve pocket. If you want to wash the case, it's very simple. You take a damp cloth and wash the outside, so there's no fingerprints or any kind of lube left over on it. But very useful, very easy to clean. Nothing challenging about this at all. Okay, let's talk about some questions that are specifically about Climax control. I have 18 minutes of questions left, so this will be great. So would you say injection or vacuum therapy is better for Climax control? I think what what's being asked here is when you're treating erectile dysfunction, there's a bunch of ways to do that. Pills, for example, vacuum erection device therapy, injection medications, and penile implants. So the medical options are the first three, right? And lots of guys who are on injections for their penis report delays in achieving orgasm. Sometimes it's a good thing. Sometimes they're very happy with that. Sometimes they're not particularly happy with that. Depends on the guy and his history of this issue. But the delays in orgasm accompanying injections are very common and usually chemically induced, sometimes also due to discomfort with the medications, which is pretty rare. Most of the time, it's just a chemical induction of the medication causing that to happen. For vacuum erection devices, on the other hand, it's really the ring that causes orgasmic and ejaculatory delay because the ring that you have to use on your penis is not always all that comfortable, right? And so that can disrupt or distract you from sexual activity. It can make it difficult to achieve orgasm and ejaculate. So is one better than the other for climax control? I think they both are, not really necessarily intended for climax control. They both sometimes result in delays in orgasm and ejaculation. And I don't think one is better than the other one. I think it just depends on what you're looking for in the circumstances. Is topical treatment effective against moderate to mild premature ejaculation? Yes, absolutely. As I'm saying earlier in today's talk, promescent excuse me, is extremely useful for this purpose. It's a very, very useful medication. I prescribe it all the time for guys. It's very, very helpful, very, very handy. And again, it's easy to use and very, very durable and very, very effective. Again, it's not the kind of thing where you get used to it over time and it gets less effective. It really stays consistent with results from episode to episode and over long periods of time. So very, very useful and effective for guys. Next question. It is very annoying that I have to use an injection for my erection and then it will be done in under 5 minutes. How do I prolong my erection? I would direct you, first of all, to the seminar I gave about intracavernosal injection, which was, I don't know, maybe 6 months ago, maybe a year ago, I can't remember. It's available on YouTube. I thought it went great. I had a great time doing it. Ashton was super helpful during that process. And in that process, one of the things we talked about is that as guys' erectile dysfunction progresses, they need to use higher and higher strengths of injection medications, right? So if you're telling me in this question that your erection will be done in under 5 minutes, I think what you're asking and what you're in this question is that the erection goes away in under 5 minutes. And my thought to that is you need a stronger strength of intracavernosal injection. If the question, on the other hand, is the erection's fine, but I have a problem with premature ejaculation, that's what we're talking about today. So either today's seminar or the one I did on intracavernosal injection, both of which will be useful for giving you some ideas what to do next. But whoever's prescribing your intracavernosal injection for you can help you adjust the strength of the medication to get to a strength where you have a decent erection you can use for the amount of time you want to use it. All right, page 2 of questions. Thanks for all these questions, guys. Lots of interesting stuff here. Can one still have climax control after prostate surgery? After prostate cancer surgery, what typically happens is orgasm is maintained for many, many guys, but ejaculation goes away. And that is because the prostate, the organ inside your pelvis that is removed for prostate cancer, is an organ that is responsible for liquefying your semen so it's shot out of you during ejaculation. When that is removed, you don't ejaculate anymore, which can be very bothersome to guys and very disappointing for them. But the saving grace of this is they can still have orgasm, which is a here process, not a down there process, right? So if you have prostate cancer surgery history and you no longer ejaculate, I can't fix that for you, unfortunately, but if you still orgasm and you orgasm too quickly, these same things we talked about today still apply in that circumstance and can still be used to help you delay orgasm and get to a happy climax. Is there a treatment option that will improve erection and stop or reduce premature ejaculation? Yes, as we talked about, PDE5 inhibitors, medications like tadalafil and sildenafil help improve erectile dysfunction. And very, very often for guys, when you improve erectile dysfunction, you subsequently also improve premature ejaculation. A part of this is because the medication just makes the erection last longer, makes it more durable, and makes it more rigid. And really, for many guys, for example, who are rushing to try and have an orgasm before they lose their erection, this makes that unnecessary. You can get to an orgasm in the normal fashion you're accustomed to. But again, those drugs are very useful to treat both conditions. And when they happen together, ejaculation problems and erectile dysfunction, they are very, very, very useful. I want to know Why I have so much semen leakage before intercourse as a 72-year-old male. Sir, that's a very good question. And unfortunately, in this format, I would need to ask you a lot of other questions. I simply don't have access to asking you these questions right now. What I would strongly suggest is that you see an expert in male sexual health who can help answer these questions for you. And again, that website is smsna.org to find those experts, not to be confused with menmd.com, menmd.com, for these products we're talking about today. Is there a way to increase semen mass? I believe the question actually, because semen is a liquid, is there a way to increase semen volume? And no, there is not. As you get older, the amount of ejaculate you make during sexual activity diminishes as time goes by. There is not a way to make that better, unfortunately. Lots of guys ask me this all the time. And you know, what I reply back to them is, why do you ask? And lots of guys say, well, because it's very important to me to make a lot of ejaculate. And I say, okay, I hear you. And those are things I can't help with. I can help make your penis work. I can make it harder. I can make it straighter. I can make it climax when you want, but I cannot make you produce more ejaculate. There are many products online you can find through less reputable companies than MenMD that offer you some sort of way to change the consistency or the volume of your semen. And in my personal opinion, the people who are most happy with those products are the people who are selling them, not the people who are buying them, if that makes sense. Okay, what may cause a greatly diminished climax with no other medical history? Again, this requires a lot of questions that I can't ask you in this format right now, but this is a real patient visit type level question. And I bet you, if we sit down and talk about this, if you come to see me in clinic or see one of my colleagues who treat male sexual health in clinic, there will be things that we are being overlooked that we may not actually know about. You may have neurological concerns like chronic back pain or nerve problems getting sensation to your brain from your penis. There may be medications that you're taking that you aren't aware of that would cause these problems. Maybe no medications at all. Maybe you are ingesting alcohol to a degree that may not be good for you. But there's lots of stuff going on. There's, as we saw in these previous slides, multiple different potential avenues for this to be happening. And certainly sitting down with a qualified male sexual health expert to help figure that out is a very useful idea. I am interested in approaches for mitigating premature ejaculation. We talked about that at length today. The things that MenMD offers for you is Promescent, which we talked about. Again, very useful. We have the MyHexal device, very useful as well. And we have PD5 inhibitors. There are other things as well. For example, lots of folks use off-label, they use antidepressant medications either on demand or taken on a regular basis to help delay orgasm. These are very useful. They're really a mainstay of treatment of premature ejaculation. Lots of guys don't really like that. But there's things you can do, right? There's very commonly an association with, and this has been well studied and well proven, physical exercise, both on a regular basis, but also right before sexual activity, really helps with premature ejaculation. Really helps. Is there a pill that works for climaxing way too early? Yes. As we talked about, antidepressants are very useful for that. PD5 inhibitors can also help with that as well. It depends on what the issues are that surround this problem and how we can help. Please elaborate on the scope of foreplay that can prevent excessive arousal. I'm not sure how to answer that question, but I want to point out, even though I don't have an answer for you, that foreplay is vital to sexual activity. And it really requires open communication with your partner to help figure out how much foreplay is useful for both of you and how that foreplay influences your sexual activity and your ejaculation, if there's any issues there. Which SSRI, that's the name for antidepressants, has the least amount of side effects? And what we have is Paxil and Zoloft are the most commonly used for this purpose in delaying orgasm. They also both have side effects for sure, but they are very useful for this purpose. Is premature ejaculation on my head? No, it is not. It is a legitimate problem. That's why I'm here spending an hour talking to you about this whole treatment options we have for this. Can masturbation contribute to premature ejaculation? No. In fact, masturbation on a regular basis, and particularly the same day you're going to engage in sex, so earlier in that day, for example, can delay orgasm and ejaculation, right? So every time you orgasm, it's a little bit longer how long it takes you the next time around. So if you have an orgasm at 10 a.m., I don't know if you're at work or something, maybe not 10 a.m., maybe it's 6 a.m. before you go to work, and then you have sex later in the day, that next time around later in the day will take more time, right? If you're having sex with your partner and you ejaculate too early, come back to it half an hour later, and it will take you longer to get there. Since taking escitalopram, which is an antidepressant, why is my orgasm greatly delayed with almost no ejaculation? So we talked about the use of antidepressants in treating this problem. Antidepressants, if you have normal ejaculation times, so antidepressants are used to treat premature ejaculation very commonly, right? But if you have normal ejaculation, they can induce delayed ejaculation. And sometimes those effects persist even after you stop taking medication. And there's not a great way to make that better. There are things we can try, like oxytocin, as we talked about, which works great for a lot of guys. But even if you stop the medications, these problems may persist afterwards. So see somebody who can help with this process. Okay. After radical prostatectomy intervention, I have not been able to climax. Is there some treatment / medication / solution? If you mean climax, you mean ejaculation, that's not going to happen because of the prostate cancer surgery. But if you mean orgasm, that can happen. What I strongly suspect is that your orgasm is probably not happening as well as you want because your erection is probably not as good as you want it to be. I would strongly suggest that you see a male sexual health expert to help you with your erections, which may in turn help with achieving orgasm. If you're not fully hard, you're not going to be able to successfully have an orgasm, right? Can I climax? How can I climax sooner? Again, see an expert for this. We talked about this today. Very, very important. Things like oxytocin, very, very useful. Very difficult climax. Is this caused by antidepressants and blood pressure medication, prostate removal, or both? All three of those things you brought up can cause problems with climax. I would suggest you talk to a sexual medicine specialist to help winnow down these issues and figure out what the best solution is for you. Third and last page of questions. Again, thank you guys very, very much. I was prescribed THC for anxiety, gummies and capsules, no smoking or vaping. Will this disrupt or hinder ED rehabilitation after surgery? My friend, if you mean ED rehabilitation after prostate cancer surgery, I want to say something to you that may not be happy, but that is that there is no convincing evidence of the efficacy of penile rehabilitation after prostate cancer treatment. No convincing evidence for this at all. Lots of the studies show, in fact, that it's not useful for you at all. So if your question is, will my THC for anxiety make that process worse? No. What I would strongly suggest is you find somebody who can help with this process and help you get the erection you want to have. Next, can the technique of roping cause erectile dysfunction? My friend who asked this question, I had to Google this for about 15 minutes or so, and I could not find a clear understanding of what the term roping means. And I consider myself a pretty well-versed expert in people's terminology for sexual stuff because I have to know these things. I'm talking to people all day long about their sex lives. I couldn't figure out what roping is. I'm not sure what it means. I'm to be honest with you. I don't know. But if it's some sort of masturbatory technique that you're inducing, I don't think it's going to influence your erectile function at all in a bad way, right? So my clearest point I want to make is masturbate as often as you want. Everybody, please, within safe and reasonable confines, obviously. But it's not going to worsen your erectile dysfunction. And last question, very, very important question. How do I get my sexual drive back? And please see an expert on this. They can check your testosterone, which is the prime mover, the most important influencing factor in sex drive. Not sex function, sex drive. MenMD offers a whole host of options for improving your testosterone. See somebody who can help you figure out what's wrong, and then see if they can find the right solution for you, which may very well be testosterone replacement therapy, which MenMD provides, and which we'll talk about in a later seminar. Gentlemen and ladies, thank you very much. It's been a pleasure to be here today.
If you'd like to learn more about Climax Control, you do have a few options. There are more resources in the Resource Center on menmd.com. You may visit this page to view instructional videos, guides, expert articles, and more. But you can also call MedMD at 857-233-5837 or log into the MedMD portal to schedule an appointment with a MedMD personal health assistant. And if you're interested in a MyHixel or any of the other Climax control products that were mentioned tonight, you can learn more or purchase these accessories and devices on the Climax control condition page or on the shop page on medmd.com.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.